My name is 𝐂𝐭 Agarwal, and my mother was recently diagnosed with a brain tumor. The operation was done. So, for the tumor, we used to think that she has some psychiatric issue. So, we used to go to a psychiatrist rather than go to a proper doctor to get the diagnostic done. So, the purpose of saying me all of this was that I want to create an awareness among everybody that you should not wait for something bad to happen to your family members. Instead, you should go to a proper hospital with all the proper facilities and get the diagnostic done immediately, and this can save the life of your near and dear one.
We came across patient unique presentation and history. She was brought into our hospital by her daughter with a history of altered behavior, headaches, change in the memory and hallucinations. This history, she was being treated at Calcutta by a psychiatrist, and she was on medication. When she was brought to our hospital in the casualty, she was drowsy, she was hallucinating, she had memory disturbances, and she also had one episode of convulsion. Having said so, immediately advised the daughter to get her investigated, and the best investigation for such symptoms would be an MRI. An MRI was done. We were shocked to see there was a large tumor in the brain, which was mainly in the frontal area, compressing the brain, having functions like memory, understanding, cognition, behavior. That's the reason she was facing these symptoms. Once we diagnosed with the MRI, there was a huge tumor of almost the size of 7 by 7 by 5 centimeters in the frontal part of the brain. It was causing raised intracranial pressure, as well as it was compressing the surrounding structures, which I just mentioned, and it was an extra-axial tumor, which we usually call as a meningioma. These tumors originate from the coverings of the brain. One of the coverings is named as dura mater. From these meningiomas. Having said so, the best treatment for this, and of course with a sizable tumor, the surgery which we performed on this patient was craniotomy and tumor excision. We radically excised the tumor, saving this functional part of the brain which was surrounding the tumor, compressed by the tumor, and after surgery, within a week's time, all these symptoms disappeared and she back normal to her life. So friends, the most important thing which is important when you have neurological symptoms, it is always advisable neuroimaging, which basically may be an MRI. And if you get to know about there is a tumor, we usually do a contrast MRI and confirm the diagnosis. I always recommend that you should, once have such symptoms, you should go to a center or a hospital which is well equipped to handle such complex cases, where there is an infrastructure, and we should do this surgeries center which is equipped with a good microscope, good team of doctors, and having a post-op nursing as well as ICU care. Thank you.